I actually had a child who who got out as I was getting in through one door. He ran through the next door. We chased him around the parking lot to get him to come back. So he tried to run away. So I've had all those things happen. It's all kinds of hilarious stuff you'll see.
Dr. Johnson, you're putting people asleep so they can get dentistry done because of anxieties, because of medical problems, because of physical, whatever it may be. But what about the anxiety a person, especially children, might be having before they even enter your door? Uh,
Fantastic. Hmm.
what are we doing there? We shooting him with a BB gun, which has or something? No, yeah.
Yeah, so that's an interesting question. I can answer in a couple different ways. Number one, the way how I put children to sleep right now is, they all come through the door. We put a little mask on them and they breathe in the gas and they fall asleep that way. Prior to that, I used to give a little poke in the arm with some medicine that will make them extremely sedated within about 60 seconds, and then they fall asleep. Sometimes I've had to go to the car to do it because we couldn't get the child to come into the office as a result. I actually had a child who got out as I was getting in through one door. He ran through the next door. We chased him around the parking lot to get him to come back. So he tried to run away. So I've had all those things happen. Now, if I know that ahead of time, because I talk to all the parents ahead of time, sometimes I would recommend a sedative, which we can give beforehand. And I like that to happen on the premises. I don't want that to happen at home before they come. Like that to happen on the premises. And once they're there, we can give it to them. And then usually in about 15 minutes, they get sedated. We can bring them in the office and we can do that. I've had to run into bathrooms to pull kids out who've tried to chain themselves to the door. It's all kinds of hilarious stuff you'll see. But in the end, we get them taken care of. And the parents have to help, right? The parents can't just be bystanders. The parents are there to help because they know their child best. And I can coax almost any child to do anything. Because I've been doing this for a while now, I have my ways of getting children to trust me to do what I want them to do. It comes with years of experience of doing this.
Well, you do look like a little teddy bear and like Santa Claus mixed in one, that I'm almost sure helps. And anybody who deals with children, almost most children doctors, they do have a special training in dealing with children, which probably helps also. Yes, no?
Yes, that absolutely does help. Pediatric dentists have a lot of training in that as well. And a lot of times I would chat with my colleagues and ask them how they do certain things. And I learn from them and they learn from me. And we do it together because we all have our ways of, they may recognize something that I may not, and they intervene to try to help and vice versa. And in the last number of years, I cannot think of a child we have not been able to put to sleep because we couldn't get them in the office or any of those kind of things. We have our ways to get it done. Like I said, parents are extremely helpful to us
Mhm.
in getting this whole procedure done as well. And once we can get the parents on board, it usually goes fairly smoothly.
All right, wonderful. And those ways you have to get this done, they do not involve any kind of torture type of, that,
Yeah,
like at
none of
least
those.
a lasso, the way the way it was with the indigenous people like 200 years ago. So at least
Yeah,
something like that. No, not.
no, we don't do anything to hurt. And I always reassure the parents. I said, look, your child may cry and those kind of things, but I assure you they're not going to be hurt. And that by the time you leave the office, you will be very pleased. They'll be nice and calm. They'll be nice and calm for a while. And I have many parents who say to me afterwards, wow, thank you so much. Or can I have some more of that stuff to take home to, to keep my child calm, stuff like that. Just because the way how we manage and take care of children, we do it carefully, respectfully, so that we can have the best possible outcome.
Beautiful. Any advice before we end off here this particular interview? Any advice you would have to parents at home for people with anxiety about a dentist? And perhaps I wouldn't know, but I can see there's a possibility this type of advice, anxiety about a dentist, might help up with anxiety to go to the hairdresser or God only knows what. Any advice you have there?
Yeah, so a lot of the times we try to get, if you can try to get your child interested in, you may try to get them to come to the office, the dental office, without any procedure being done. So they just come in, they look around, they see the pictures on the wall, they talk to the staff and the dentist. The dentist probably doesn't even have to look in their mouth, just talk to them and whatnot, just get them comfortable coming. And that is one technique that we use to try to get people into the mode of coming into the office without any expectations whatsoever. And that conditioning over time helps. Parents also should be modeling behavior for their children, brushing their teeth, brushing their own teeth, showing them it doesn't hurt, all these various things. Parents can help. And I know I'm actually in the process of putting together a nice little book for children to help that parents can share with them so they can read all about coming to the dentist and getting the anesthesia and all those kind of things that will be helpful. So stay tuned for that coming up pretty soon.
Well, all right. Well, Dr. Johnson, thank you very much. I think the whole thing is very helpful and calming for parents to kind of know there actually are ways keep the child safe to maybe prevent the child from future difficulties
Absolutely.
actually be
Yes.
arising. After all, when it comes to almost everything in life, and especially with health, an ounce of prevention is worth a pound of cure,
Sure. Hmm.
and whatever that really means. But basically, if you tackle a certain situation, doesn't always have to be a problem, but a situation when it's young, it's usually manageable, and it just if it is a situation. It could eventually always grow into a small problem, and it always, no matter what, is more difficult to unwind. Is that
Yes.
correct? Good.
Yes, that's correct. Absolutely.
Dr. Johnson, thank you very much. Bye bye.
You're very welcome. Okay.